Good morning. This morning we will be talking about oppositional defiant disorder, something that's becoming more and more prevalent in our classrooms today, and oftentimes it can just be viewed as bad behavior. So we're going to look at some of the science behind it, get a little bit more of an understanding of where it's actually coming from, and to see if there's anything we can do to manage it. So let's first look at the actual definition. So what is ODD? Oppositional defiant disorder is a disruptive behavior disorder in which a person must have a pattern of angry or irritable mood, argumentative or defiant behavior, or vindictiveness lasting for at least 6 months. So that's a really important part of it, the lasting at least 6 months, because it's not defined as a pattern up until that point, like a behavior pattern up until that point. And it really involves ongoing resistance and negativity, but it's not deliberate misbehavior. That's oftentimes what it gets labeled as this child is making the choice to do this. That is not the case. It's not deliberate misbehavior. So we've really got to come to an understanding of the why behind the behavior. That's the key to getting at why this child is reacting the way that they are acting. And love this quote: defiance is a function of the relationship, not a flaw of the child. So we've really got to look into how we're relating with that child or how we're not relating with that child, because oftentimes that can be the actual problem. Okay, so a couple of the signs and symptoms that you might see. So oftentimes these appear in preschool years, and then they become more prevalent as the child ages, especially up through elementary school. That's when they're really starting to interact with authority figures, and oftentimes that's when it can come to a head when the ODD symptoms start to kick in, especially with the peers and because the setting is structured. So obviously you can see some of the signs are frequent temper tantrums or arguments with adults, refusal to comply with rules or requests, blaming others for mistakes or misbehaviors, being touchy or easily annoyed, having vindictive or seeking revenge. The behaviors are vindictive. And then a low frustration tolerance, so really not being able to work with something for very long before disengaging and becoming combative. Again, as you can see at the bottom, it has to have been present for at least 6 months and have significant or cause significant difficulties at school, home, or with peers. So I know it seems hard to differentiate. All kids argue. All kids can be combative. The difference with ODD is the intensity and the frequency versus a child of their same age. So you've really got to look at how often it happens and how strong, how guttural that reaction is. A big thing is when the ODD causes them to really it interferes with their obviously their behaviors interfere with their relationships and with their ability to learn at school. Another big thing that you'll hear me say this again in this presentation, ODD often appears with other challenges such as ADD, ADHD, anxiety or depression, learning disabilities, and mood regulation disorders, because a lot of times it boils down to it is not a coping mechanism, but it's a way that they are having control in essence. All right, so some of the causes of ODD. There's 4 main ones. Biological. So one of the really interesting things I think is that brain imaging actually shows differences in certain regions of the brain with children with ODD than in a normal functioning child. So a couple of the things is in the prefrontal cortex, which is responsible for like your planning, your impulse control, all of that. So in an MRI versus a normal functioning brain, with the ODD brain, this part, the decision making and impulse control, was underactive or less efficient. So their brain was literally not able to perform as a fully functioning, healthy decision making brain. Also, the amygdala. We know that's the part that is the fight, flight, fun, all of that. In the brain scans, kids with ODD oftentimes have an overactive amygdala. So they're not even processing the information that is being put in. They are reacting immediately. So their amygdala definitely they flip their lid, that fight or flight is impact, and they react very strongly. It's also been linked, ODD has been linked to disruptions in key brain chemicals that affect your mood, your self-control, so dopamine, serotonin, all of those, a lot of, not the feel goods, but the things that SSRIs would help. And then obviously, or not obviously, but also ODD tends to run in families. So there could be a genetic component. That's not proven yet, but there's research looking at it. Heritability estimates that it's between 40 and 60%. So nearly half of the risk of having ODD may be biological, in fact. As you can see, a lot of the other, with environmental, the inconsistent discipline, lack of structure, you have got, with these children, they have got to know what to expect. There could be a written schedule in place. There could be a behavior intervention plan. Whatever it is, they have got to know what to expect, because that's a lot of where their frustration can come from. As you see under the psychological, emotional dysregulation, low frustration tolerance, negative thinking patterns. So all of that can cause ODD. And then with social, peer conflicts, so they definitely are struggling when having relationships with their peers, could be with adults, all of that. And then academic frustration, because many kids with ODD also have underlying learning disabilities or ADHD or learning processing disorders. When the work feels too hard or too confusing, the frustration skyrockets. Their amygdala, boop, goodbye, flip their lid, that's the end of it. So instead of admitting difficulty, like saying, I don't get it, a kid with ODD will often mask their embarrassment with defiance. Like instead of saying, I don't get it, can you help me? It will be, this is stupid, I'm not doing it. They might elope, they might leave the classroom, they might, whatever the situation is, however they react, a lot of that can come with academic frustration. And then definitely remember this part. Defiance becomes a defense mechanism to protect their self-esteem and their perceived failure. Obviously, it's not failure. It's what they are perceiving as failure. So, lots of causes. Impact in the classroom can be monumental. Obviously, kids with ODD can challenge teacher authority. They want to have that control. So that's one way that you might see it in the classroom, refusing to do assignments or following directions. Again, if something is too hard or undesirable, goodbye, they're done. They might disrupt lessons if they do not understand. They can affect the classroom climate. Obviously, if you've got a combative child, it starts to trickle down. Other children may not feel safe. So it's really you've got to zone in on it pretty quickly. And then kids with ODD can also require frequent redirection and individualized plans, which obviously that requires another step for teachers if you are making sure that you're meeting legal guidelines for what this child has to have. Down at the bottom, please read that 4 or 5 times. Teachers may feel personally targeted, but it's important to remember that the behavior is not about you. It's a response pattern. So absolutely 100%. It's so hard to think, oh my goodness, this child, or so hard not to think rather, oh my goodness, this child hates me. They do not. Their brain is not functioning on all cylinders. We've got to help them fix those misfires and read those cues a little bit better. So trauma and ODD, a giant one. ODD behaviors can be rooted in trauma or chronic stress. Again, we know that children with trauma, oftentimes one of their coping mechanisms is to have some sort of control over something. So that can very easily lead to defiance in the classroom because they're trying to control what little they can, being 8, 10 years old, however old they are. Students may use defiance as a coping mechanism or a protective mechanism. They are literally doing what they can to protect the things that are within their control, which not too much. So they'll use it to cope. And then obviously, as we know, trauma-informed approaches can help reduce this behavior. If we are managing the behavior, but we've got to really get to the why of where in the world did this behavior come from. So strategies for teachers. This one is definitely something that can be useful. Obviously, children with ODD need, as we talked about, they need that consistency. They need to know what to expect. So stay calm, stay consistent, set clear routines and expectations. Offer choices. This could take out the need for them to misbehave to be in control because they're in control of their academic choices. Use positive reinforcement, not punitive measures. We know that trauma can be cyclical in nature. So if you are literally punishing them because of a trauma response, you are further cementing that trauma response, and the cycle just keeps going and going and going. So positive reinforcement. I know sometimes it's hard in the thick of things to really, sorry, my lights turned off, to really think, how can I be positive? But you have to, or else you're just going to be in a nonstop battle and everybody loses. Build relationships. I'm going to say that again, build relationships before you correct a child. You are not going to get anywhere with a child that has ODD unless you have a solid, trusting relationship. They have got to know that you are not trying to, I don't want to say change them, but you're trying to help them. So you've got to have that relationship before they will actually go with your guidance. And then obviously utilize school counselors. I know that seems obvious, but sometimes it's really hard when you're in the thick of things to think of all the outreach things that are available. So just always reach out if you need to. Check the bottom, because most strategies to cope with ODD fall within the clinical setting. It's critical that teachers are armed with strategies to scaffold students within the general education setting. There's not too much, there's some research out about how teachers can help deal with ODD, but most of it is within the clinical setting and within cognitive behavior therapy and all of that. And while we can do parts of that in the classroom, there's just not time. So hopefully more strategies and things will be coming, but here are a few, the ones I provided, that obviously can help in the meantime. Now, there is a quick YouTube short that I want to share with you that talks about supporting kids and kind of the stigma for children with ODD. Let me make sure we can hear it. So yeah, that is the main part of why I wanted to show that short, was just because you've got to build the relationship. Literally, step one is you and the child need to be on the same playing field as far as knowing that each of you are extremely valuable, extremely important in that relationship, and having the best interest for one another. Okay, so communication tips. When this is communicating with the child, specifically with the child that has ODD, stay calm and neutral. Maintain respect and dignity. Focus on collaboration, not compliance. So make it more of a, we are going to work together to do this. I'm going to help you to do this, not you will listen to me because I'm the teacher. We know that does not work. Choose your battles. Oh my goodness. If we chose every battle that we could every day, that's all we do. And so, no, thank you. Choose what's most important. Choose what is going to keep that child safe physically, emotionally, psychologically, all of that. But you can't address every single behavior. Avoid public reprimands. Now, I will say, all these communication tips, I honest to goodness feel like should be in place for every classroom. I don't care if it has a child with ODD or not. Avoid public reprimands. That does not work. Public humiliation, it should be a thing of the past. Absolutely ridiculous, in my opinion. So avoid that, because that's going to cause further lack of control, further frustration. Not a good thing. Provide private, respectful feedback. That will work, because they'll not feel like you are targeting them as if you were to publicly reprimand them. And then also, obviously, make your instruction with students with ODD differentiated, and make small achievable goals. Don't have it be this project is due in 2 weeks and you're not getting any feedback until then. That is immediate frustration. So just make sure that all of your goals are small, attainable, maybe a couple a day, whatever it is. Every relationship obviously looks different, but let them have that choice. All right. Sorry about that. Collaborating with families and support staff. So this is another Really important one, because you've got to be able to connect with that family. Also, the family needs to know that you have their child's best interest at heart. So communicate consistently and respectfully with parents. We want them to, when they speak of you at home, speak highly, so that further seeds are not planted within that child of a negative connotation of school. Share specific observations, not labels. We know that in meetings with parents, we cannot diagnose a child. That is beyond our realm. We can just share the things that we're seeing and provide our advice, but obviously we're not labeling children. Reinforce progress, not perfection. Just tell them what you are working towards. Don't say they've met it or not. That's not going to work. Just make sure you're reinforcing the progress and how far they've come. As I said earlier, work with your counselors, your psychologists, your administrators. Everybody is typically on board to help students get to where they need to be. So please reach out and utilize all the support services that are there. And then obviously you can develop a behavior intervention plan if needed, where that child has certain targets that they're working towards. They could be working towards the treasure box at the end of the day, or so many amounts of checks or stars or whatever they need to earn during the day when they meet those target behaviors. So that's always another strategy, or even like just a check-in, check-out with the school counselor, something like that, just to hold them accountable, but also let them know that you're rooting them on. You're in their corner. These kids need to know that we love them and that we are fully invested in what they are doing. All right, so there are a couple scenarios that you're going to work with the friends at your table. You're going to do a behavior mapping chart where you are listing the trigger, the behavior, the consequence, the function, and an alternative that could have been a better option than what happened in the scenario. So if you will, scan that QR code. I'm going to pop that up on the screen for just a second to make sure that you are in the right area. So you will see we've got scenario 1. It runs through each one of the scenarios. And then when you are done, we will pop through, look at all the trigger, behavior, consequence, function, alternative, everything for each of those 4 scenarios. All right, when we are done with that part, pop back to this presentation. All right, so your key takeaways, if nothing else from this well, hopefully you got more than this, but ODD is a pattern of emotional dysregulation. It is not willful defiance. No child is coming to school thinking, let me have a terrible day. This is perfect. I'm going to make her day horrible. That's not a thing. Connection before correction. Make sure you build that connection so that you can then help that child to change what needs to be changed. Consistency, structure, empathy, and teamwork are key. You have got to have all those foundational things in place and the predictability of everything for these children that struggle with this to be productive. And then every student can succeed with the right supports. Absolutely. That is our job as professionals to put those supports in place. And then, quote, I love, children who need the most love will ask for it in the most unloving way. So it is our job to see why they are acting that way and help them to scaffold that behavior to a more productive behavior. Now, one thing I'll need, please, if you don't mind, is give me your feedback. If you would scan that QR code, I'm going to show you, it'll take you to a Google form that just lets me know how I did, what you learned, what else you might need to know. So if you will, just fill that out for me, and I hope you guys have a great day. Thank you.